Ayaka sat. Osaka, Japan 2033. As dawn breaks over Osaka, Ayaka wakes up. She goes through her morning routine in the quiet serenity of her apartment, steeped in age-old tradition and modern innovation. Ayaka pours freshly brewed green tea into a delicate porcelain cup and pauses to gaze at the intelligent display adorning her wall, a nearly invisible part of her home's framework. Her assistant updates her efficiently on the day's schedule, the health status of her patients, and snippets of news. Ayaka steps outside, receiving the city's unique historical charm and cutting-edge technology blend. She steers her electric bike effortlessly through narrow lanes, passing traditional machiya houses. Their wooden facades whisper tales of the past and nestle amidst sleek AI-powered smart structures. She pedals to the healthcare center, serving as a nurse there and becoming a liaison between the human heart and AI-enhanced care. Today buzzes with a difference. Hiroshi Tanaka, the founder of a prominent AI startup and one of her patients today, is more than just another patient. His role in Japan's AI evolution makes him a significant part of the world where technology and people engage in intricate dance. Hiroshi's startup soared, and his technology stood at the forefront of the wave that swept Japan. Ayaka, a curious yet hesitant bystander, observed the societal unrest and the U-turn phenomenon triggered by Hiroshi's unchecked AI growth. The AI Higai data breach served as the breaking point, exposing the vulnerabilities of this digital intrusion and shaking public faith. Ayaka started questioning the role of AI in her life and work. The backlash prompted a shift, a rethinking, and a reimagining of AI's role in society. Japan's government and industries fixed the framework, finding beauty and resilience in its flaws and integrating ethical guidelines, privacy protections, and cultural values instead of rejecting the broken system. Ayaka witnessed these changes firsthand in her healthcare role. AI now forms part of caregiving, providing precise, personalized care, supporting rather than replacing. As Hiroshi lies in his hospital bed, he confronts the technology he once championed and watched society rebel against. Ayaka, a caregiver and a nurse with the ingrained sense of omotenashi, the Japanese spirit of selfless hospitality, steps into his room, leaving the past behind. In the following days, Ayaka and Hiroshi find common ground. She shares the experiences of her patients, the initial apprehension. Hiroshi speaks of his journey, the heady days of unfettered growth, the painful backlash, and his role in the recovery. Through their conversations, Ayaka learns about Hiroshi's regret and desire to correct the course. He acknowledges that he contributed to the problem and wishes to be part of the solution. Inspired by Ayaka's tales of kintsugi-like eye recovery in healthcare, Hiroshi decides to guide his startup in a new direction. He commits to creating AI applications that enhance human efforts, not replace them. The AI systems will be transparent, with an understandable decision-making process and control in human hands. Interacting with Hiroshi brings Ayaka a new perspective. She understands that, while she can't undo the past, she can learn from it. It is the mono no aware, the Japanese concept of embracing the transiency of things, learning from the past, and then letting go. It is a liberating thought, and it brings Ayaka peace. In her world, I exists as a reality, a tool, a partner in progress, and an extension of humanity. Her experiences with Hiroshi strengthen her faith in Japan's path for its AI evolution, one where cultural values stand unaltered by technology, where wiles and monotony exist alongside algorithms and machine learning. Hiroshi leaves the hospital, Ayaka, and feels fulfilled. She understands that her role as a nurse extends beyond physical healing. It includes bridging gaps, finding a balance, and embracing change. That evening she returns home, her spirit echoing the peaceful harmony of her city.